Alright, this is a very interesting case in a 78-year-old who'd had a bypass in 1992. The aim of showing is my own view about very old venous grafts. So he had venous grafts to his LAD, circumflex and RCA. So the RCA graft closed down many years ago, and this was done in 1992. So 34 years back he had a bypass. Since then he had 5 angioplasties which converted first the circumflex graft into a full metal tube, and then the last one on the 11th of August he had a part of his venous graft to LAD which was not stented before, and that had an ulcer and caused an aborted MI. So this is his angiogram. This is the graft to a diagonal, I think, not to the RCA. This was RCA graft was occluded. This is a full metal jacket done in about 2 times. He had interventions where this 33-year-old was converted into a full metal jacket, and it's still persisting. This is the 34-year-old graft. This is the other graft. So this is the same graft, LAO view, and this is the LAD graft, the only other graft which had stents all the way from here till here. This part is uncovered with stent, and you can see that he has got an ulcer here. This is an ulcerated plaque, and he had a aborted MI, severe resting chest pain, not much leaking of troponin, ST changes, and then settle down on heparin thing. So there's an ulcer in this area. So you can see, so the objective of showing this case is that we can convert and maintain these grafts, these very old grafts, by converting them into full metal jackets. And this is one of my 7 or 8 patients who've had more than 30-year-old venous grafts. By the way, the Lima was assessed previously and it was atretic, and that's why it was not used, or it's been wasted. So this is that ulcer here. This is that ulcer here which had caused that event probably. And this is all stents up here, and there's a stent at the junction at the anastomotic site. The right coronary is occluded previously. So now difficult to wire this case. So we now show you the angioplasty. So this is that conversion of a 34-year-old graft into a full metal jacket. This was the only part which had caused an ulcer here and which was uncovered. Difficult intubation, double wire, and then we needed to balloon the ostium as well in order to get access, then used a guide liner here to get access, proper access, and then had a stent covered the whole of the remaining segment which was uncovered with a stent, so converted this into a full metal jacket. And then a few other, so then it was simple ballooning, and now you can see that this is now a full metal jacket now, and this is fine. The patient, this was again DEB'd, DCB'd, because there seemed to be some obstruction here, some residual in-stent treatment. This was done a year back, this part. So now he's got a full metal jacket, and this is now a good result. And angiographically, you can see that the whole thing is covered from bottom till the anastomotic side, from the bottom all the way up. And this is the only vessel which is serving, and the right coronary artery is filling from here. So his overall EF is slightly impaired, but otherwise the patient at his age of 76 or 78 is pretty well, has done pretty well over the last 1 week since his angioplasty.